right. Thank you so much for tuning in this Tuesday afternoon. We're so excited to continue along with our In Bloom Political Education series, a series that we're doing this summer to really dig into topics related to our policy priorities and just issue areas that we want to learn more about along with our supporters. And so we've been discussing issues related to the family policing system, doula care, and we're excited today to really dive more deeply into public benefits and what that looks like in Tennessee. So I'm Brianna Perry, her pronouns, and I am the executive director at Healthy and Free Tennessee. And if you're tuning in, I am assuming you have some familiarity with Healthy and Free Tennessee. And just in case you're new to our platform, we are a reproductive justice organization working to grow the movement across race, gender, and class, and really looking at the intersections of criminalization, incarceration, and reproductive oppression, fighting back against the growing criminalization when it comes to pregnancy outcomes, as well as parenting. And we know that one of the ways that parents are criminalized relates to whether they're able to access public benefits and what comes up in that arena. And so I'm so excited to be in conversation with Jane Denwobi today. And Jane is the Equal Justice Works Fellow at the Tennessee Justice Center. So I'll pause right there and Jane, just pass it to you to share more about yourself and your role. And then we'll get into the questions related to what public benefits the landscape looks like in Tennessee.
Thank you so much, Brianna. Yes, I'm so excited to be here and talking about the Public Benefits Program. So, as we said, I'm an Equal Justice Works Fellow at Tennessee Justice Center, which just means that as an attorney at the organization, I work on cases, but I also do a lot of research into policy around public benefits. So, whether that's healthcare with, TennCare, TennCare Medicaid, or with the SNAP program and all the things we'll talk about today. So I graduated from law school in 2023 and I joined TJC then. So I've been here for 2 years. And in that time, I've seen a lot happen with the public benefits programs, both at the federal level and the state level. And this is, I think we can talk about what's to come, but I can also talk about what I've seen just in 2 short years here. So, like I said, I work on Medicaid, I work on SNAP, which is some people know as the food stamp program. I work on Families First, which some people might think of as TANF. And those are my three kind of main buckets. But TJC as an organization works on WIC, which is a child nutrition program. We work on school meals, which is, when kids are in schools, getting them fed, and we work on summer EBT. So quite a lot is covered with TJC's across TJC's teams. So I've had the benefit of seeing these different programs in action, and I can talk a lot about the opportunities and the roadblocks with each of them. So that's kind of what I can preview.
Yeah, thank you so much for previewing that, Jane. I know, just kind of anecdotally, I come across different questions, like some like friends and family members who are really interested in like, okay, what's going on public benefits wise in Tennessee? They may have read an article or, a hurdle that they've encountered. And so I know this is a timely conversation, and there's much to get into. And so I first want to start with what does the landscape look like in Tennessee when it comes to public benefits programs? You already spoke about the types of assistance that's available. So I also want to give you an opportunity if you want to share more, like a description of each of the programs. But yeah, what does the overall landscape look like here in Tennessee?
Yeah, so Tennessee has a robust public benefits program, like many states do. A lot of these programs are actually housed in different federal agencies. So when people talk about things happening in Congress, a lot of times they are related to public benefits. But then Tennessee has its own way of doing things, like every state has its own way of doing things. So we are a state with Medicaid, which folks will know here in our state as TennCare. We have the SNAP program as well. and we have a couple of other nutrition programs. So health and nutrition are some of the biggest buckets of public benefits because people need healthcare, they need food. But there's also Social Security, there's housing. These are other components of the public benefit system, but that is a little bit outside of TJC's work and outside of the scope of the conversation today. So we'll be talking a lot about the individual benefits that people get from health and nutrition programs. So TennCare is a health insurance program for low-income folks. It is a health insurance provider for people who are under a certain income limit. A lot of them are children, sometimes the parents of those children, a lot of older adults who live in nursing homes, and then
Mm,
for people with disabilities as well. And then it's also something that covers people who have diagnoses like breast cancer and cervical cancer. They can get TennCare for once they receive those diagnoses. So
mm,
you can kind of tell it's for a really critical population. It's for people who literally need this health insurance to survive because they don't have the kind of jobs that provide them health insurance. So
mm,
some people might get their health care from their employer, but there are a lot of people who work a few part-time jobs and not enough hours with each to get that health care coverage. That's just the reality.
yeah.
So Medicaid is really helpful when you're in that kind of struggle in a place that maybe you're struggling to get health insurance, and it can just kind of provide that safety net, which is literally the intention of the program. And again, it's most beneficial for children, and it's most beneficial for folks who are in nursing homes or folks who have disabilities. So if you're working a low income job, you can get TennCare,
Mm,
but it does have pretty strict income limits. So there are folks who might not qualify. That's by far the biggest bucket of the safety net here in Tennessee. There are about 1.4 million people on
mm,
TennCare. And then we've got the SNAP program. So SNAP is some people call it food stamps, but it's a food benefit program that essentially gives folks money to pay their groceries. So
mm,
in Tennessee, this is eligibility is based on your income, your household income, and whether you have any money in the bank, any resources, any savings. So when you
mhm,
kind of look at that, the goal is to help people who again are struggling to make ends meet, struggling to kind of meet their overall basic needs. If they have kids or older people in the house, SNAP really comes through to make sure that groceries are affordable. So the maximum that a family can get on SNAP, an individual can get for SNAP is $292. So that's the money that will go towards your groceries when you're in the store. And that you can imagine that makes a huge difference for people who are
mhm.
groceries.
Yeah, groceries
So
are so high.
groceries are so expensive, and that money again, it's a lot of times for people who are already working and are doing their best to make ends meet, but they just can't quite swing it, and they rely on these programs just to fill that gap. Um, the average benefit is $150. So we kind of see a range, whether you're getting that average of 150 or the maximum of 292. That's
Mhm,
a huge, huge dent in what kind of like what you pay at the end of the day at the grocery store.
mhm, mhm,
And then again, nutrition, child nutrition is a whole separate world. We have WIC, which is another grocery program. So if you have a child, or if you're taking care of a child under the age of 5, you can actually use this program to, again, afford groceries. And the difference with WIC versus SNAP is that it is primarily um, geared towards mothers or pregnant women who are about to have children
mhm,
or again, children who are in that first 5 years of age. And it's limited to particular foods. SNAP has restrictions too, but WIC is really for a very specific set of foods for what's considered like a growing child.
mhm,
So you can use it for those early years, and it's a huge, again, boost to the affordability. I mean, vegetables are expensive, milk is expensive, so the things that kids need can be expensive, and that's what WIC kind of why WIC steps in.
mhm,
And then, yeah, school meals, summer EBT. When it comes to kids in schools, there are a huge portion that receive free meals when
yeah.
they're in school or reduced price meals. And the benefit of those programs is it's one less. First of all, if kids are in school and their parents can't afford to pay for their lunches, they can't go hungry, right? Like, I mean, the struggle is how can kids focus in school if they're hungry and if they're seeing their classmates eat? So the school meals program, the National School Lunch Program, helps uh, kids who are in school uh, have access to that breakfast and lunch. And with those programs, again, it just covers a concern that families might have. But then in the summers, when kids aren't in school, the question is, can the parents afford to pay those two meals that were being paid for at school? And that's where summer EBT the summer feeding program comes in. So the goal of those is to make sure that during the summer, families have a way to pay for kids' meals as well, if they happen to struggle with that. So the goal is really to catch kids when they're in school, kids when they're out of school, parents when they're taking care of kids in the early years, anyone who is starting to feed themselves throughout their lives, and then everyone in the healthcare system. I mean, it's pretty complex. A lot of these programs are connected. If you're eligible for one, you get to do another one, you get to be eligible for another one. I mean, it's a very complex system. And I get the vantage point of seeing it as an attorney because I get to work on cases, I get to do research into the policy changes. But for one individual, it can be very overwhelming to take it all in. So that was like my attempt to paint a picture of what's available, at least on the health and nutrition side, and get us started in kind of talking about what challenges folks might face.
Yeah, thank you so much for that, Jane. And I just think it's helpful to like talk about each one and then also what you were saying, like, okay, oftentimes if a family qualifies for one program, they can qualify for another program. And I know that, we're focusing in on kind of like health, nutrition, food. But there's like a whole nother conversation around TANF, and I know
Yeah,
that's
yeah,
been in the news for some years because of like stockpiling resources that's happened in Tennessee. And there were just like a lot of conversations, especially with the onset of the pandemic and families needing
yeah.
direct cash payments to just survive and try to navigate an unprecedented pandemic. Just quickly, I know again that we're gonna dive more into the programs that you mentioned, but if you could just say a little bit on TANF and kind of like what that looks like in Tennessee.
Yeah, absolutely. So thank you for bringing up TANF. TANF or Families First is a really critical program as well. Like you said, um, there has been a lot of attention. The intention behind TANF is cash assistance. So unlike some of the other, Medicaid doesn't pay you, TennCare doesn't pay you money. It covers your health payments, right? It reduces what you might have to pay. Same thing with SNAP. It's money that's preloaded on a card that you can take to the grocery store, but and spend on very specific things. But when it comes to TANF, that's just cash that families get to cover their needs on their own terms. So it has a lot more flexibility than some of the other programs in terms of what you can do with the money. But then it has a lot of barriers too. So there are a lot of income restrictions to being on TANF. There, you have to have a child in the home to be on TANF. It's again primarily geared towards families with children. There are pretty strict work requirements with TANF, and you can only get exemptions if you have a disability. And again, um, yeah, they're just a couple of obligations you have with your personal responsibility on TANF. So it's a great program. It has great potential, but I would say of all the programs we've talked about, it's the most underutilized. There are about, in any given year, 25,000 people on the TANF program compared to 700,000 on SNAP and 1.4 million on TennCare. So it's really a program that we want more people to use, and that's why people keep bringing attention to it, is because it's potentially a life changer, a game changer, but the state has kind of limited who is on the program and how they're using it. So, yeah, a really, really critical part of the safety net.
Yeah, yeah. Thank you for uplifting that. Hey, like, trying to get more people enrolled and able to access that benefit. And that leads into this next question because a lot of what we think about at Healthy and Free is like ensuring that people have the right to something, especially when it comes to comprehensive sexual and reproductive health care. And with the reproductive justice framework, it really asks us, what does it mean if someone has a right to something, a right to get certain services, or services and resources exist if people don't have access? And so, in theory, these programs exist, and you've already started to speak about it a little bit. Barriers are in place. They exist, that impact Tennessee families in trying to access these supports. And so, yeah, just wanting to invite you to speak more about, like, what are some of those barriers, and how does TJC try to help families with accessing these supports, including if it's like information sharing, kind of what we're doing here. But yeah, just wanting to go there next. What are the barriers, and how y'all are supporting folks with accessing these very critical resources?
Yeah. No, I think that's really the bulk of the conversation because we could talk all day about how great these programs are, how many people they help, but the fact is the regular person is just trying to understand if they can ever even get on them.
Mm,
And that's the question. That's where TGC steps in. So I would say the main barrier is understanding eligibility. So when we're talking about these programs and we're saying that they're income limited, the state has to make a determination. So whatever agency is running the program has to make a decision about if you are eligible. So are you under the income limit, et cetera. And that requires information. That requires the person who's applying to supply a lot of information. Sometimes information they don't have, information they don't understand. Depending on their circumstances, it can feel like too much work to
mm,
even
mhm.
comply with some of those requirements. So some people have said that it feels like filing your taxes, but then you have to do that every so often. And imagine if you're on multiple programs, you're doing it each time because you're looking at these forms that have, 10, 20, sometimes more pages. You're having to find your pay stubs if you work multiple jobs, multiple pay stubs. You're having to provide all these verifications. Sometimes you're asked to provide a few things when you first apply, and then they're like, oh, we need more information. And then all of a sudden you have more asked of you. So I think it really just comes down to complying with the requirements to even see if you're eligible. And that's in large part where TGC comes in. We help with a lot of TennCare applications. We don't always help with SNAP applications, but we have a referral system for that. But we do help if people do apply and then they have questions after that. Because once you get past the application hurdle, maybe your services are getting denied. Maybe you were eligible, you got approved for the program, but then they're not covering a health service that you need. They're not you got $200 one month, then $150 the next month, but nothing
Yeah.
changed for you. That happens often. So you have to reach out to the agency, ask questions, get on the phone and sit on the phone for hours, or maybe go in person. I mean, it's like so many things come up when you're just trying to get to the bottom of what's going on. And then if you have to file an appeal, I would say that's the highest level of a challenge because in some cases, it does really benefit you to have an attorney to review
Mm,
everything. And then that's the benefit of TJC because we have attorneys who take these types of appeals for Medicaid, for SNAP, for whatever. So if you don't have an attorney, imagine you're trying to read through the federal rules, state rules, whatever, just to figure out what went wrong with your case. And that might just feel really intimidating or confusing or frustrating. And in some cases, folks are like, I give up, right?
yeah.
Like
Yeah.
at that point, you've gone through the whole process to get certified, to get on the program. You thought you were good, something happened, kicked you off, or reduced the benefits you were getting, and now you have to go through the whole process again to appeal, and you don't even know what the outcome is going to be. I mean, people just don't want to deal with that. Because
Mm,
again, we're talking about folks that are working, that are struggling to make ends meet. They have kids, they have older adults they're taking care of. I mean, it's not like you're sitting around all day just trying to figure this stuff out. You're doing it with the 30 minutes you have to spare between this obligation and that one. So the
mm,
barrier really comes with that pressure that folks just, in a lot of cases, need help managing. And that's what TJC does. We have a robust intake system so that we can understand your problem and work with you if we want to if the situation requires an appeal or someone to directly contact the state. We
Mhm.
have a way of getting to the bottom of most issues at this point.
Mhm.
Um, and yeah, I think it really just, again, comes down to understanding the process, getting the verifications. There are, of course, particular situations where people struggle the most. If folks are experiencing, if folks don't have housing, for example, it complicates everything because these programs, when you apply and either you get approved, denied, or they want to ask for additional information, they need to mail that notice somewhere. I mean,
Yeah.
it need an address. And without an address, you are back to square one.
Mhm.
So we can't always receive mail for people. We don't believe that it can get complicated, I guess, collecting mail for multiple clients. So in any case, we figure out a place where their letters can go because that letter tells you everything you need to do. And if you don't get that letter, you don't get your benefits, whether it's health, food, whatever. So having an address is key. And then kind of in the same vein, you can do a lot of the stuff online. You can do a lot of the applications and appeals. You can do them online. But do you have a computer? Do you
Right.
have internet? Is your phone kind of current enough to use the app that they've redesigned? So that's I mean, it's so overlooked sometimes, but
Mhm.
not everyone is at the same level technologically. That's a whole barrier that we see constantly for folks like, well, my phone doesn't work with the TennCare app or whatever. Um, if folks don't have transportation and they can't get to the office, the DHS office to get their card or their SNAP card, or they can't get to see us. I mean, they're just
Mhm.
these practical realities that will really affect people. It's just like one thing after another, essentially, which is really critical in terms of why our services matter.
Mhm.
Um, I would say that those are the main barriers across TennCare and SNAP. And I can probably like come up with more things, but for the most part, it just has to do with getting over the finish line with the amount of information you need to provide and staying on time, like with all the deadlines.
Mhm. Yeah. Whew. And just kind of like how you laid it out, especially um the realities of people's lives. Like you said, people have families, they have children that they're trying to make sure, like, getting ready for school, and they have jobs and they're doing elder care. And, I don't even have the time to be on the phone
Right.
for hours. And so I can only
Yeah.
imagine. And from what you shared, though, I am thinking about it's kind of like a curiosity. Just like a thought, because I'm very big on the libraries and the branch that's closest to my home. The librarians there have said quite a few of their patrons are unhoused folks. And so yeah, just like, oh, in addition to people coming to TJC's office, are there like partnerships with like libraries where people can go and get on the internet, any workshops that people like, folks are doing or thinking about in collaboration with the libraries. And so, anyway, that's something that um, comes to mind because I know just different branches that I've gone to in the city, they talk about how, yeah, like libraries, like people don't always know the resources that are available, and they're like looking to like deepen community partnerships. So yeah, just curious, based on what you said, is have y'all like explored something like that, kind of like maybe going to where people are at, and like if they are going to the library and on like accessing the internet there, have y'all like done any collaborations with different branches across the city?
I don't know of a specific collaboration with the library, but that sounds amazing. That's definitely something that I would love to raise to our outreach and intake group. We have or I guess we have had events at the Pruitt Library. That's closest to the TJC office.
Mhm.
And so we're not necessarily going there uh, for enrollment assistance. So it's not like folks are coming there just because they need help with 10 care or SNAP, because
Mhm.
they just come to our office for that. But we set up as TJC, which just includes information sharing about all the programs that we have. So there are those, and I think particular group that benefits the most is the unhoused population. And at that point, we can survey them at a high level and say, like, okay, what can we help with if you're
Mhm.
eligible, right? Because that's the other thing. You might not even be eligible.
Yeah.
So, yeah, we definitely have had that more as a just a general community event, but I love the idea of it as targeted. And we do a lot of outreach events at schools because, again, parents with kids will get informed there. It's very convenient for them. And we have a lot of events targeted towards seniors to answer those
Mm.
questions that they might have. And of course, just general community fairs across mostly Middle Tennessee, but we do get to East and West as well.
Hmm. Hmm. Yeah, yeah. Thank you for that. So with this next question and kind of goes into what we were talking about at the start of this conversation that, there's like a lot of conversation and, people having questions, people reading different things. So there's a lot of conversation around the recent actions at the federal level, the cuts to Medicaid, and rightfully so, makes a lot of sense. People have been asking, like, okay, now how does this impact us at the local level? And so, yeah, that's what I want to turn to. How have these recent actions at the federal level impacted availability of programs and access? Yeah, just what will it mean for Tennesseans who are enrolled in these programs or maybe eligible? What does that look like, and how are y'all navigating that?
Yeah, so you're referencing the One Big Beautiful Bill Act, which was
Mhm.
signed into law July 4th. So there are a lot of different federal actions, to be clear. There is a lot going on right
Yes,
now
that's true. That's
yeah,
true.
to balance, and they all have interrelated effects, so that people are still unraveling. But the one that has been signed into law that we know 100% is coming down to impact Tennessee and all states is the, again, One Big Beautiful Bill Act, which I'll kind of talk about as HR 1. So that is a bill that does, again, a ton of different things, but we can focus on the Medicaid and SNAP portions. So it cuts the goal of the bill is to preserve tax cuts that were put into effect years ago during the onset of the pandemic. And that has a lot of benefits to individuals, which is why it got a lot of support initially. But so people want their tax rates to be low. Okay, great. But the reality is the way that the federal government had decided to save money for those tax cuts is by cutting the Medicaid program at the federal level, Medicaid program and the SNAP program. The Medicaid program was ultimately cut by $1 trillion and
Mm,
SNAP was cut by 186 billion. So we're talking like the big bucks. I mean, like the
yeah.
amount of money that has been stripped from these programs is almost hard to comprehend. So I'll
Yeah.
try to like you guys like break it down. $1 trillion isn't even something that we can conceptualize as spending money, but just know over the next 10 years, it's gonna have a pretty significant impact on the healthcare system, which is why we're concerned. So one thing that folks need to know is the way the bill is structured is over 10 years. That was just kind of the timeline for the changes.
Mm,
So 1 trillion is over 10 years. And that's about $1 trillion a year at the federal level. So that's hundreds of billions from all the different states,
mm,
including Tennessee. So Tennessee is set to lose somewhere around $7 billion in federal funding,
mm,
which is a huge, huge portion of its budget. And one of the reasons that number is not higher is because Tennessee never expanded Medicaid.
mm,
So we don't
mm.
have to talk about Medicaid expansion per se, but it's basically would have been a decision that would have increased the number of people that were on Medicaid. So it would have increased the amount of money Tennessee lost. But because we've kept the program small, we're losing that 7 billion, but it could easily have been way more. Like other states are a little bit more affected, actually. So Tennessee's losing lots of money for Medicaid, and that correlates with a lot of people losing health insurance. So at the federal level, and these are predictions by a federal agency, is that 17 million people are estimated to lose coverage. I
Mm,
mean, that is a huge number.
yeah.
So a bunch of them are going to lose Medicaid, and a bunch of them are just going to be impacted because of the increased costs, and the projection is that they'll be kicked off the program eventually. So we're really worried about this
Mm,
sharp, like, I mean, the sharp decrease in funding for Medicaid and sharp increase in people who are going to be uninsured. And in
mm,
Tennessee, it looks more like, a couple, I think the last estimate was 240,000 people would be uninsured at least based on these
mm,
changes. So we're talking about 240,000 people who had healthcare yesterday, or let's say they have healthcare this year, but they don't have healthcare next year. That's
mm.
prescriptions, that's doctor's appointments, that's
Yeah.
surgeries. I mean, that's everything you need to continue to live your life. If your health isn't taken care of, that's interrupting your work, right? That's interrupting your schooling. That's interrupting your ability to be a parent, to be a
Mm,
friend, to be a caretaker. I mean, the health impacts are just so multifaceted, and we don't know who exactly is going to lose their coverage, but it's just with that money being, with the program being shrunk the way it's going to be shrunk, it it means that there's just going to be less room for people on Medicaid, on TennCare.
mhm,
So we can just expect that again, that hundreds of thousands of people to be moved off over the next few years. So we
mm,
can watch out for, if you're on Medicaid, we can watch out for it being harder to be on Medicaid. So
mm,
we were in a position where, like I said, there's so many barriers to being on the program. It can be really challenging for people and very frustrating. But the uh, federal government had already kind of taken steps to make the program more streamlined, which is to say, just a little bit easier for the
mm,
average person to get through from point A to Z. This bill took all that away.
mm,
All of those streamlining rules were repealed. So they're no longer in effect for any state. And in fact, all states are prohibited from enforcing some of those streamlining rules. So all the progress that was being made to make the program simpler is no longer going to be made.
mm.
And now the reality is, all those barriers that people have, any way to kind of improve like information collection, or maybe just make the program simpler, is not going to happen anymore.
Yeah. Yeah.
That's by far the worst impact, is all this progress to make the program simpler is just kind of done.
Mm,
And then we can also think about particular things like nursing home staffing. Again, a lot of people on Medicaid are in nursing homes. Like,
yeah.
it is a primary payer for older adults who are in nursing
Mm,
homes because they're not working. And
yeah.
folks really rely on Medicaid to balance the cost of a nursing home, which can be $4,000 to $6,000 a month. I mean,
Mhm.
you can save for retirement, but a lot of people can't save for that. So they run out of their retirements quickly, and then they need somebody, like some help to pay to continue to live in a nursing home. This bill harms nursing homes as well. It makes it harder for nursing homes to enforce staffing standards, which means
Mm,
if there isn't enough staff, that's medications not being
yeah.
administered on time. People will have injuries, they fall, or um, they otherwise need help in a nursing home. If there's not enough staff, who knows how long they're waiting before someone can kind of identify that there's been an issue. It's food quality, it's cleanliness. So this rule removes some of those standards that would have improved nursing homes, and it just kind of again sets progress back. So it's
Mm,
just things like that. It's decreasing enrollment, it's increasing the number of uninsured, it's harming nursing homes, it puts rural hospitals in danger. That's a whole other part of it.
yeah. That Tennessee's
Um,
already struggling with like hospital closures. Yes.
Exactly.
Hmm.
So the particular issue with that is nursing homes or rural areas really rely on Medicaid because their populations tend to be low income and tend to rely on Medicaid. So
Hmm.
Medicaid dollars are like a huge lift for rural communities in Tennessee, and that is documented. So with this bill, The rural hospitals, rural communities are, crying out saying, no, like this is going to harm us. This is going to potentially close our hospitals, a problem Tennessee, like you said, already has. So
Mm-hmm.
it is, we're heavily watching rural areas to see how they adjust to this bill, but that's definitely one of the critical areas. And of course, I mean, the one of the worst parts is that it kicks more immigrants off the program.
Mm.
So Medicaid is not a program that's primarily for immigrants, but for some individuals who have a green card, they could maybe qualify. Um, and previously, if you were a refugee, if you were a victim of human trafficking, or if you were here as an asylum seeker, you could get Medicaid temporarily, for about a year, and or longer for some people. The problem is these people have been kicked off the program.
Mm.
So when we talk about a safety net and who needs one, in a lot of cases, we're talking about this group. We're talking about people who are literally here as refugees. They oftentimes know no one and they're starting over and they just need help. And that's just like been stripped away.
Mm.
Um, and you can pretty much expect the same thing on the SNAP side. The amount that's cut is 186 billion,
Mm.
but the SNAP program is less expensive than the Medicaid program, so that 186 billion is pretty tough. So it just makes SNAP way more expensive here in Tennessee. And the one way to look at it is the federal government was covering a portion of the cost of SNAP, and the state was covering, let's say, the other half, or yeah, the other half. Now the state has to cover 75%.
Mm.
That 25% increase is nearly nearing $200 million. So that's $200 million the state has to find every year in
Mm.
order to fund the SNAP program. So the reason folks are nervous and fearful is
Yeah.
because if the state doesn't have $200 million, are people going to get SNAP? And our goal at TJC is to make sure that that answer is yes. We want to
Mhm.
advocate for the importance of this program. We know it's a lifeline for many people. We know that without SNAP, people will go hungry. So we want to make sure we can still have the program, but the reality is the state has been really hurt in its ability to pay for the program, to afford it. So the federal bill has just thrown the health and nutrition landscape into chaos, and we're really in a position of still untangling those effects. But what we know is healthcare is going to become more expensive for many people, and so is food.
Mm-hmm. 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 Yeah. Thank you for like kind of like sharing like, the bottom line, but also um just people's like everyday like material conditions, like how those conditions are going to worsen. And we're talking about people who, as you spoke about earlier, who are already struggling to make ends meet. People are experiencing like layoffs, and just when it comes to income and the just increasing cost of living, it really just paints a really devastating picture. But in a healthy and free, we know there's so much resistance that's happening in rural communities and other places, and that gives us a lot of hope. But we want people to, have like this sober assessment around like, okay, this is like actually what's at stake. This is actually what this means over the course of 10 years. So I really appreciate you painting that picture. And in a landscape, like, as you also mentioned earlier, where like people already have issues accessing the programs and, completing forms, and to, have that like streamlined process taken away, like this is how it's going to like impact people's lives. So I really appreciate that. Um, with this next question, I do want to begin by saying that Another big goal with the series, like one, and I shared at the beginning, is to really dive more deeply into issues that we care about at Healthy and Free that we're advocating for, and be in conversation with people who are working more closely, and how these conversations can better inform our policy priorities. And with that, the second piece, as we are really grounded in the reproductive justice framework, is to make these deeper connections. Like, okay, how is, one issue such as environmental justice, and we had a conversation a few weeks ago or last month about environmental justice and reproductive justice. What are the connections there? And I want to turn to that question and ask you that, how is public benefits advocacy a reproductive justice issue? There are some things that Healthy and Free has been focused on. A few years ago, we were able to advocate for a really exciting win around 12-month supply and TennCare recipients being able to have a 12-month supply of birth control dispensed at one time. We know that, kind of what you're laying out, like people who access to health insurance, and also like living in rural communities, it's really critical for their care to be able to have like a 12-month supply. So that's something that we worked on. We also have been working on for some years now, expanding access to doula care, and namely through doulas being eligible for TennCare reimbursements. And so those are some connections that I think our supporters are familiar with, but wanted to just, yeah, invite you to share more about, like, okay, these public benefits programs and advocating for them to not only protect but expand them. How is that connected to reproductive justice, and why reproductive justice supporters and allies should learn more about public benefits in the landscape in Tennessee?
Yeah, so I would say one of the main reasons that folks that are in the Healthy and Free Tennessee or Reproductive Justice Network should pay attention to public benefits is because poverty is the issue that the public benefits programs are trying to solve, right? Or trying to alleviate. And we're in a position, I think, to understand that. In a lot of cases, poverty strips people of their choices, whether reproductive or otherwise. And a
Mhm.
lot of the goals of the public benefits program is to give people agency back, right? It's like to give them room to make decisions about their own lives. And poverty is really harmful for children and for families.
Mhm.
And part of that goal of reproductive justice is a world where if you do have children, if you do have a family, that you all can thrive. And I
Mhm.
think that there's some really critical ways that the public benefits system can do that, especially for families who have children and for people who are considering having children. Um, you gave a great example with the doula coverage in a state where there's an ongoing maternal health crisis.
Mhm.
And despite efforts from the state, there have only been kind of meager improvements in mortality rates for Black women who are having children. We can't, like, part of the reproductive justice conversation is beyond um, contraception or anything like that, is really about what does a healthy birth look like if that was an option that someone was to have, which is why the doula conversation is so important. On the other hand, a TANF example with the TANF or Families First program is TANF was created with these purposes that were, I hope to some people just sound very just outdated. The goal was a two-parent household,
Mhm.
basically forcing a two-parent household, work encouragement, limiting the number of children that a family has, and just these kind of idea of a two-parent household with a few kids so that we can move away from and I use this term because this was prominent at the time, welfare queen. Like it was that stereotype of
Mhm.
low-income people of color relying on, like, abusing the public benefits program.
Mhm.
And one of the examples of that was something called the family cap. So if you're on TANF and you have a child, um, you're eligible to get a certain number of benefits again so that you can hopefully pay for things that that child needs. If you have a new child, this was before, you couldn't get an increase in benefits. So now you're
Mm,
making that payment you got based on your household having one child, you're making that stretch for two children or three children
yeah.
because the state refused to, the state was imposing this cap on what the family size would be because they didn't want, again, like it's this idea that you don't get to choose how big your family is, or if you do get to have a larger family, well, we're not going to pay for it. So that was repealed. That happened in 2024, so about a year ago, which is great. That repeal means that if a family does have more children, they can have more money to pay for the needs of those children. They're not going to be punished for having more children, right? So I think that's one example of how poverty, public benefits, and reproductive justice intersect is because the perception, there's some, in some cases, there's a dehumanization and a lack of
Mhm.
choice given to people on public benefits. And we're trying not to talk of what they're actually getting from the program, right? Like, let's like assuming everything in the program actually works, right?
Mhm.
There's still a dehumanization and a lack of agency in how people are seen for participating in the program. And I think one of the goals is to, I don't know, bring it's not my role to bring dignity to anything, but I think when I talk about these programs and their benefits, I try to talk about that agency and again, like going back to choice. Like I think that's a perfect example.
Mhm.
Um and I would say the WIC program is another example of that. So these are the WIC program is a way for someone who has a child. You don't have to be you don't have to be kind of like the mother or anything like that. It can be any caretaker
Mm.
who's raising a child within the first 5 years, they can get nutritious food so that the child can actually grow. And I think that that is a huge benefit as well, because one of the sacrifices folks make when they have to cut corners in the grocery store is vegetables, right? It's like fruit and produce, things that are sometimes have a higher price tag.
Mm.
So anything that gives folks more room to make decisions in how they raise their families and how they have children and how healthy their children are, to me, is worth investment in the reproductive justice work. And I think is within the broader reproductive justice framework. So, yeah, it's really important that these programs are sustained
Mhm.
because without them, there there's really no safety net for people.
Mhm.
And that's just not a world that we want in Tennessee or anywhere.
Yeah, absolutely, absolutely. And something that we've been thinking about with our Poverty is Not Neglect campaign, speaking to like, people who are trying to raise children, families in pretty intense conditions, and if they give up because of like the barriers, or they're just not able to access these programs that they are eligible for, how that also becomes like a pathway for family separation. And so that's something that we've been thinking about deeply, and again how these issues are so deeply connected, and yes, that we must fight for all of them, so that communities, so that families are able to thrive, so people are able to be self-determined, is and that's the world that we're fighting for. So I really appreciate you, Jane, and this conversation. I have learned so much, and I am like looking forward to like looking different things up, and this recording going out as well. And so I just have one last question, and it's just really about like plugging TJC a little more, and just how advocates, how supporters can get more involved in these issues. What are the best ways for Tennesseans to learn more about the resources available, and how them being empowered with the information they can help themselves and communities. So yeah, how can people get more involved? Where can they turn to learn more?
Yeah. I this won't surprise anyone, but I want to say the first thing is to get educated. The public benefit system is, if you haven't been on it, it's very easy for it to be out of sight, out of mind. But the
Mm,
reality is there are millions of people just here in Tennessee, let alone around the country, who rely on these programs for all the reasons I stated, just to live and to make ends meet. And like you said, to keep themselves afloat so that they can avoid these disastrous outcomes like family separation. Um, and so I think just understanding that the public benefit system exists and what it means is really critical as a starting point. Because again, it's not the most headline grabbing topic
yeah.
talking about 10 care. It's not everyone's cup of tea talking about SNAP, but I mean, it's just the reality for a lot of people, or at least in terms of whether they um, are able to survive day to day, it is their reality. So I think just getting informed so that you can shed more light on the value of the public benefit system as
Mm,
in your broader conversations about reproductive justice. And you can start with TJC for that. I think in the state of Tennessee, we're one of the organizations that really makes a significant effort to educate folks. I talked about our outreach efforts. We have a website with lots of educational materials, which I can share the links with you for your supporters to receive. But if you just go to tnjustice.org, that, I mean, you can get anything you need to know about the particular programs I talk about, or just our work overall. And then I think it's also worth it if people have the capacity to join TJC in some of our, again, educational or outreach events. We accept volunteers, we host webinars, we plan events. And there's a busy charge ahead with all the changes coming to the program. So we need all the help we can get to kind of maintain some semblance of I don't know, assistance for people. Like we don't want these programs kind of the rug pulled out from under us about what these programs look like. So having folks engaged with us in our event is really critical. We make a lot of noise about the value of these programs, so anyone who can join that uh, group is just is so helpful. So I think just getting educated about public benefits, don't let it, don't like this. Hopefully, this isn't the last time you're hearing about 10 Care Snap or others. And then joining TJC and some of our events, like we have weekly, we used to have weekly webinars, they're now monthly, but we have a ton of educational opportunities on our website.
hmm Yeah, yeah. Thank you so much for that, Jane. And we'll make sure that people have the links. And I really appreciate the work that y'all are doing, the work that you're doing. Is so critical. And again, like it's just um such a important issue to like really direct people to the connection to reproductive justice, but all these other, issues that folks are working on, economic justice, environmental justice, what have you. So yeah, just appreciate you taking the time to talk with me, to educate me and our supporters. And we know that you're really busy. So really appreciate the time and the investment that you're making in us by sharing all this information. So yeah, we to our supporters, we'll be continuing along with our In Bloom political education series next week, and so just want to invite folks back to learn more about kind of like public benefits and other things related to services that Tennesseans can access to really be thriving in communities. So thank you again, Jane. And yeah, we'll make sure that people have those links and really will lift up, people educating themselves, having information, and then sharing that with other people because probably more times than not, they are like connected to someone who could really benefit from the information and could be eligible and looking to access benefits. So really appreciate you and thank you all for tuning in.